So this fall, Greg Saltzman and I are teaching a class through the honors program on health policy in the U.S. and Canada. The idea being that we need to be looking at our healthcare system as we continue to talk about, and most people agree that there needs to be some fixes to what's going on. Where do we look to see how things have been done and how they shouldn't be done? So our closest neighbor, probably one of the ones that we can link to the most, is Canada, and it provides many lessons through their nationalized healthcare system that's been in place for many years now. We hear a lot of things about, good things about the system, that people like it and value it, but we also hear about the stories of inadequate care, inadequate resources. What's acceptable to people, what we're going to fight for, what we're not going to fight for, is going to change all the time. We've seen that with the public option over the past couple weeks. It's in, it's out, now it's back in again. I think it's going to be fun, and that's what makes this course fun to teach, is that it is changing. It does give us something to talk about, and it's easier for the students to think about it because if they're not being led by what they're reading in the media all the time. They're dealing with new issues all the time. So how do we address those, and how do they fit into this class and their future? Having Greg as an economist and myself as an epidemiologist, policy person, it just makes it so much fun to hear his thoughts for me on the things that I think about a lot and get that serious economy input into it. So the students get the benefit of even listening to the two of us discuss these issues from time to time, because we're bouncing ideas off of each other, or we're learning something from ourselves during these conversations.
We have two sophomores in the class who are also in the Ford Institute as well as the Honors Institute, and these two sophomores are both very political. One is a very conservative Republican. One is a very liberal Democrat. Very serious about politics, but they're able to speak respectfully to each other, and they understand they have different viewpoints. So I've been pleased, really, that there haven't been any times when the debate in class has become nasty or personal. But people express different viewpoints, and there's, I think, a pretty good climate in the class that people feel comfortable expressing views, knowing that others in the class may disagree. You can talk about contentious issues, and you can have different viewpoints and vigorously defend your viewpoint while being respectful to others, and maybe sometimes changing your mind when someone with a different viewpoint has something that you hadn't thought about before that really makes a good point. I also think an important aspect of this course is we want to train the students to become lifelong learners, and so having them wrestle with challenging articles sometimes in scholarly journals is a way of preparing them. If someone becomes a physician after graduating from Albion College, and they're going to read an article in the New England Journal of Medicine written by an economist about health policy, even though they're not an economist, they should be able to wrestle with some of this material. And so that's another important thing, sort of preparing them to become independent learners who aren't spoon-fed all of their information by their professors, but that they can wrestle with some of the literature on their own.